Welcome back, everyone. So the next session is going to be a company presentation. The company that we're going to learn about is Novodontics. Novodontics electronic health record allows dental practices to manage patient intake, patient care, clinical charting, billing, and revenue cycle management. Vital measurements, flow sheets give providers the ability to create baseline health data and monitor each patient's health measurements over time. Speaking on behalf of Novodontics, very pleased to introduce Dr. Louis Alfaraj, who is the founder and chief executive officer of the company. In addition, he literally defined and authored the art of oral implantology. His name has become synonymous with results-oriented oral implantology treatments around the world. So, Dr. Alfaraj, turn it over to you to introduce.
Hello, everybody. I'm Dr. Louis Alfaraj. I would like to thank David from Davos in the Desert for the invitation to speak at this technology conference. And I'll try to be as brief as possible, but also try to cover most of the features that Novodontics offers to its subscribers. I would like to share my screen now. All right. So Novodontics is a practice management software, but it's built on the latest technology, 100% cloud-based, and that means, for those who are still not familiar, you don't need in your office anymore server. You don't need an IT guy who would come every week or so to fix certain issues. And you do not need to pay for backups. You do not need to pay for upgrades. You do not need to pay for support. The word cloud-based means you pay a monthly subscription for the platform, and the use of the platform, the storage of the data, the technical support, the upgrades of the software, all included in one monthly payment. So cloud-based is the way to go, because you do not need to have a server, so there's no chance of the server going down due to floods, fires, God forbid, or any other reasons why servers go down. You perfectly know, most of you have been through that. So Novodontics.com is the website where you can go and learn about Novodontics and all the services it offers. However, if you're a subscriber, and here we're doing a demo for the probably most prominent features, you would click on login. That will take you to NovodonticsPMS.com, PMS for practice management software. Once you log in, I'll probably actually go to a demo, another account here, to show you probably more features on an account that is set up for multi-locations. All right, so you will log in. By default, you will get to the appointment book, and however, you have also a dashboard where the software will display data, a certain data, so you know lots of information about your practice at a glance. But we're going to go to the patient file to show, obviously that's where you spend most of the time. We will pick a patient, and I would like to demonstrate the things that we offer that other softwares don't offer, beside the obvious thing that we're cloud-based, which the majority of softwares are not there yet. Now, this software is for general dentists. However, we have lots of features also built for offices that are heavy on implant services. So you have lots of tools available to you to have the implant services in your office more organized, and that would be of a great benefits again, for offices that offer implant services, surgical, restorative, or both. So with that in mind, you can see the sophistication of the patient information data collection, which you might think this is very basic. However, even here, if we go to health history, you can see here, once you mark the medical conditions that the patient has right now, we have a graphic depiction. So at a glance, you can see what organs are affected by the health for this patient. And then if you have a patient going through chemotherapy and your implant dentist, so for any surgical, not necessarily implant, but for any surgical and implant procedures, you would follow a certain protocol for patients that are going through chemotherapy. If the patient is diabetic, of course, these conditions affect um, uh, greatly the outcome of implant treatment. If the patient diabetic, you can still do fillings and you can still do crown and bridge work. That really, those treatments would not be affected by the condition of the patients. However, again, with diabetes and surgical procedures, including implant procedures, you can see that this is a different ball game now, and certain protocols would have to be followed as to minimize the risks of these treatments and affect positively the outcome of these treatments for these patients. So diabetes, chemotherapy, bisphosphonates, again, there is a protocol. All those protocols are taken from the organizations that have to do with these disorders, if you will. So there are set protocols already for surgical and implant patients, how they should be treated, what kind of lab work we will need to ask for, and what results in these lab works we need to look for to qualify the patient, if you will, for these therapies. Also, collecting vitals, the blood pressure, oximeter, pulse, oxygen saturation level, even body temperature. For diabetic patients, a glucose level and hemoglobin A1C. For patients on blood thinners, in particular Coumadin or warfarin, the INR numbers. So here, Novodontics provides the opportunity to, in a very clean way, log all this data, and the data goes here, and you can see at a glance the history of all the vital measurements taken on the patient. If any measurement is out of the normal range, you can see here it's displayed in red. And if we click here on eye in a circle for more information, Novodontics reminds you, if you will, with all the normal ranges for all those vitals. And this is where the information was taken from for you to see also the source of those normal ranges that we provide as a reference to decide if this patient is within normal limits, etc. So now the patient came to the office, and they went through this very sophisticated data, health history data collection. And again, the software would help you with indicating if the data provided is within normal limits or they need attention. If the patient is contraindicated, that also is provided. So then the software after that provides you with a very clear photography guide, and it tells you of course, what photographs we should collect for the patient for cosmetic dentistry, for implant dentistry, even for general dentistry. It would be nice to have all those photos available. And for every photo you upload, of course, you will have a timestamp. You can upload as many photos as you want in every category. You can see here for every photo, Novodontics provides a guide on how the photo should look like. For example, this happened to be full face frontal, no smile. So the software tells you the camera setting, what lens we use, background. This happened to be, again, no smile, so lips are together, both ears are visible, the entire head and neck should be in the image, and you focus on one of the eyes. And what you evaluate on this photo, this happened to be, again, full face frontal, no smile. We evaluate here facial proportions, face symmetry, lip characteristics, and shape of face. So, of course, gets more sophisticated for mouth in repose, for example. The software tells you that you should take the photo with the patient mouth open slightly, like half an inch, with absolutely no smile. However, in if the patient has negative incisor display, you would need to have additional photos taken and uploaded with the perioprobe to be able to see the amount of negative incisor display. The state you happen to have, as you can see here, like -1 and -2 for the mandible. And then if excessive display, as you can see here for this lady here, then the perioprobe now not on the incisal edge, but on the lip, and to show that she is now showing in repose 8 millimeters of incisor display. This is very important for cosmetic dentistry to provide the patients what they want to have a baseline for the start of the treatment, where we were and the goal, etc. So that's very helpful. In full arch implant dentistry, this would be, all these photos would be helpful to calculate the amount of alveoloplasty needed, or maybe no alveoloplasty is needed because the patient went through some bone resorption already adequate to provide the treatment, etc. So again, these very clean and organized with a guide, a way to upload all the patient's photos to the system. If you are into full arch implant dentistry, we provide 14 questions that you will answer during consultation. Some of these questions, the answer you get to from evaluating the CT scan. The other questions are soft tissue related, so from the patients being in the chair. And then, of course, you can also get all that information from the photos later on. Should the patient calls with some questions, you have access to adequate amount of photos for proper evaluation and proper treatment planning, which leads, of course, to a reduction in the possibility of complications when adequate amount of data collection was obtained before the treatment. All right, so these are, I'm pointing to the things that we really our software is very unique in the sense that it provides a very sophisticated way to collect data and to analyze data. So it's very educational in a way, and the extra information available upon request by clicking on those more information circles, if you will, to remind yourself with the goal of what we're looking for or what the options are for this or that particular question, etc. So we move on to, we have here checklists also available, over 30 checklists available, especially for novice dentists getting into general dentistry, implant dentistry. On say for implant dentistry, what are the risk factors, and for every risk factor, say patient's age, patient sex, patient size, all these are risk factors. And for example, for males, you have more powerful chewing muscles, chewing forces. Accordingly, that would be a little bit a higher risk than female. And then younger patients have more powerful chewing muscles and chewing forces, if you will, applied onto the implant prosthesis and accordingly onto the implant bone interface. So that would be, the younger, the higher risk, the bigger the patients, the higher risk, etc. We don't want to spend too much time here, but also if you're evaluating the CT scan, Novodontics tells you exactly, reminds you if you would like to follow the checklist about every single possible anatomic landmark that is visible on a CT scan, so you can do a very thorough, complete evaluation and expert evaluation with very maybe little experience for novice dentists, but will help you again to have a better quality of care for your patients. Of course, Tooth Charts offers whatever out there in any other software. It's a complete full charting for existing conditions or treatment plans, or primary teeth and tooth status, unerupted, erupted, etc. There is nothing special here. It does provide absolutely everything other softwares offer, but maybe in more organized, more clean, more pleasant user interface for that. We offer a period chart, and again, it's very complete and easy to follow for recording for perio measurements for the patients. We offer endo charts for endodontist or general dentist who would like to provide a very sophisticated way of evaluating teeth for possibility of root canal therapy, and then all that is recorded, and you can see here how sophisticated is all those checkpoints for a tooth for the purpose of providing root canal therapy for this patient. And from radiographic evaluation to clinical examination and treatment recommendations. So this is very helpful. And again, the goal here is to improve the quality of care provided to patients from doctors who are using our platform. So this is very nice. Let me show you a very also unique feature. If you like to share a patient file after getting permission from the patient, they sign special consent form, and if they are, they will consent to sharing their file with another healthcare professionals. So Novodontics here, with a few clicks, provides you the opportunity of sharing parts or the entire patient file with other healthcare professional for the purpose of maybe referring this patient out to, say, a specialist for whatever reason, to an MD, or for the reason of consulting with a colleague regarding this patient and have a second opinion on the treatment intended for the patient. So with a few clicks, you are able to share a part or most of the, not 100%, of course, of the patient file is shareable, but most of it. Or you might need to share only the health history and the CT scan and the photographs for the purpose of consulting with a colleague, with a consultant for that purpose. We have also consultants available if you would like to have an expert consultation. So you click here after you share you select, of course, you would select a consultant, and then you would pay a minimal fee for the consultation that can be up to a full hour on a Zoom with an expert, an endodontist, periodontist, an implant dentist, an MD, an ENT, etc. So you would request a consult, you will share the file with the consultant, So this is another service we provide, again, for the purpose of improving the quality of care you provide in your office. You're not alone. You can have, of course, help when needed at push of a button. So, of course, we provide electronic. Of course, we provide electronic prescription. We provide electronic claim submissions. We provide electronic eligibility requests, electronic attachments for the e-claims, cloud-based imaging module. So, you know, to prescribe for the patient. Let me see, I guess this account has no prescription privileges. All right, so so all that is available, of course, through the system. And now I want to cover also the scratchpad feature, a small feature, but is very helpful, where you can, of course, instead of having a pen and paper, you can explain to the patient, you know, treatment you'd like to do. And of course, all those sketches you will do on the iPad, chair side, or on the computer screen can be saved for future reference. They can be sent to the patient if desired. I would like to cover also the clinical notes. So you are able to create pre-made notes, as most of you probably do currently. However, we also provide a very sophisticated form for really state-of-the-art way of creating clinical notes. So the way you do it now, by going to the software setup, and you go to clinical notes, and you can create you know, a note, and you can see the note here. And now at any time, or we can create a new one here. You give it any name you want, you fill the note. And of course, now when you are ready to write the clinical note after the procedure is completed, you click on the clinical notes, add a note, and you will go down here and you will select one of the notes templates that you created, and it will be filled automatically right here. And you can, of course, edit as desired. This is what you do now. When everything is done, you can sign the form. However, you can also follow our form, where you can indicate if there is oral sedation involved. You have a very sophisticated way to log that in. For local anesthetics, you can select from all available in the market, in the US market, number of carpules, and what kind of technique you follow to administer, if you will, and route for the anesthetic, what time it was given. You added there. When you do implants, you can see here very sophisticated way of logging the implant from the implant side to the brand, the surface, and everything is down. Everything is a drop-down menu. You can select from almost everything, from diameter, the length of the implant, surgical protocol. You have only possible 3 choices: 1 stage, 2 stage, immediate loading for those who place implant. You know what I'm talking about. Bone density, you have only 4 types. Osteotomy sites, you have really 5 options only. Initial stability in Newton centimeter or in ISQ. And then implant depth relative to the crestal bone, if you will. Loading protocol, if the surgery was guided or not, what kind of guide, when you think the implant is ready to be restored. So now you enter all that data very quickly. It takes only a few seconds, really, after a little bit of training. For bone grafting, for implant prosthodontics, for endodontics, you have that very sophisticated way of entering that data instead of simply using a template. But if that is the desired method, you can do that. Now, when you enter an implant, it goes automatically to the implant logbook, and here you are able to track the trend of implant dentistry in your practice, because at any time you are able to go and run a report from this date to that date, say from last year, September 14th until today, for all providers working in my office, for all implant brands that we use, for all implant protocols, um, for all implants. You can generate reports, and quickly you will see again all the implants placed and how many. You can also, every time if implant would fail, you would come here, you click on edit, and you indicate the failure, the removal date of the failed implant, the reason for failure. You can connect medical conditions with the failure, and accordingly, you will be able to run reports later to see why implants are failing in your office, what's common in between all failing implants, and that hopefully will lead you to do maybe changes in your technique, or changing your implant to brand, what have you. But my point is that's all very helpful information. Not to mention the economics of being able to very quickly run a report for per dentist to see the amount of implants they place for the purpose of paying them, etc. So this is really a very good thing. So you can stay on the top of these services offered in your office. What else we can cover here in the patient file? We have, of course, you can set a recall, you can access appointment history, and you can go to any appointment with an ease by clicking on the date of that appointment. You will go to that in particular. Doing e-claims in Novodontics is a breeze. With a few clicks, you are able to generate a claim and send it to the clearinghouse that we use, and then follow up on payments, etc. So extremely easy to really generate e-claims and submit e-claims, and do attachments to these e-claims in Novodontics, if you will. You can do texting through the software, and in real time you can do texting to the patients. Patients will text. Everything is saved in the patient file. All the texting happened with the patient. So all that is one thing which Novodontics provides, which is the practice management software. Maybe last thing I want to mention here before moving to the next thing we offer, that we have full version available on the iPad. So you are able to do on the iPad absolutely everything you're able to do in your office on a computer desktop, if you will. So that's all one thing. And now we offer a very robust continuing education platform, currently with over 300 live lectures recorded by the best speakers in these topics from many, many different countries, and that in collaboration with Quintessence Publishing. So you can pick a topic from prosthodontics, as you can see here, oral surgery, photography, operative dentistry, implant dentistry in the aesthetic zone, full arch implant dentistry, digital dentistry, and you have lectures available, usually all of them roughly 45 to 60 minutes. You can click on the lecture, you can watch, or you can request a continuing education credit for that lecture you watched, automatically you will get an email with 10 questions. If you answer 7 correct, you will get a 2-hour CE certificate per lecture. So this included in the monthly subscription, depends on the tier you select. We have also as additional service is online programs. That's an additional if desire to take online programs. Those usually give 50 or 100 or even 300 CE unit for our online fellowship, very popular. So this is the continuing education that we provide that, to my knowledge, no other practice management software offers. We offer a marketplace. We were able to negotiate and leverage the number of subscribers with these companies. There's over 50 vendors here. As you can see here, 31,000 items where you can have a corporate level, a DSO level savings, even if you are one dentist with single location. You're able to pay the prices that usually only DSO enjoy. And this will help you be competitive and have your treatments more affordable for your patients when your overhead is lower. So from equipment to disposables to implant dentistry to bone grafting to general dentistry, um, you know, items that you need from filling materials to disposables, etc. So all that is available to you, included even in the lowest tier subscription of Novodontics. That will save you, 500 to 1,500 a month, depends on of course, the size of your practice and how many patients you see, and how many providers in your office, etc. So it's a practice. Just as a recap, Novodontics is a practice management software. It is expert support for when you need it for certain patients. It is a continuing education platform, and it is an online marketplace. So we combine all these four products, if you will, under one umbrella. So everything is you go to with one login. You do not have to have multiple subscriptions. I forgot to mention that we have very sophisticated patient engagement built in, all native, from online patient registration to appointment reminders to recall reminders, birthday messages, paperless forms that include consents, post-op instructions, medical release, and of course, text to pay through our online payment feature. So very powerful, complete patient engagement package available, and again to you through a Novodontics platform. So absolutely everything under one umbrella, and to make your practice management easier and mainstreamed and accessible on any computer, Mac, Windows, iPad. So we say access all your information or all your practice related things from anywhere, anytime, any screen with the Novodontics platform. So this is in a nutshell what Novodontics does. We would like to thank again David from Davos in the desert. We would like to, if you have any interest, you are in need of cloud-based practice management software, you are thinking about switching to a more sophisticated, more powerful, more capable software than what you're using now, or if you are about to open a new office or new location, we would love to provide a demo for you by going to novodontics.com. You can click on schedule a demo. We welcome, of course, new customers. We're never too busy for you. And we welcome distributors. If any distributors now are watching this and they have interest in adding a practice management software to their portfolio of products they offer to my fellow dentists. Also, we welcome distributors. If you're a dental student and you're watching this, you get free access for as long as you're a dental student and a full year after graduation. So, David, this is what Novodontics does, and I would like to thank you again for this opportunity.
Well, thank you for speaking to us, and thank you for introducing us to Novodontics. It seems to be a wildly robust platform. It's very impressive. So a couple of questions came up. So when you were talking about checking the status of the patient as far as chemotherapy or diabetes treatment, can it also check by prescription that patient is on to see if the prescription may cause a conflict with implants?
Yes, but that will come up currently only if you want to prescribe uh, uh, a new prescription. It will remind you with the existing prescriptions taken and if there is any interference. But currently, it only reminds you about the medical conditions, and it does not tell you that the patient is taking this or that medication unless you start prescribing for the patient. Then yes, the um, prescription module does warn you about possibility of interaction with certain medication taken, etc. We are incorporating more and more AI in the software. So in the near future, it would really have more warnings popping up with the certain treatment plans or certain procedures you're about to perform. Uh, but we have quite few already, but we keep adding more AI, if you will, features to have, to have more of a help for you available, more reminders for you available for a better treatment planning. Yes.
Okay. So does the patient have access to Novodontics as well? So if I have an implant and I have pain or swelling or whatever, can I contact my dentist directly through Novodontics?
Yes, absolutely. So patients also have, if you will, a platform. So they can make a self-scheduling. They would have to open an account with our patient, if you will, platform, and then they are able to see the appointment book of the provider. Of course, only available spots, not the actual patients and name of patients in the schedule, but they are able to see all the available slots in the doctors, their dentist, if he's on Novodontics, and they are able to do self-scheduling, not only for in-office, but also for teledental. So yes, we have that available. You can send new patients a link for them to click on. They will fill online registration and submit to Novodontics. They can do all kind of reminders are automated. The Novodontics users can send all kind of forms, post-op instructions, consent forms, etc., to the patient's cell phone or email. They are able to fill it, sign it, submit it, and it will go to their file automatically in Novodontics. They're able to make payments. But yes, to answer your questions, for patients of practices that are using Novodontics, they are able to do a lot on their own interface, on their own platform, interacting with the dental office without having to call.
Okay, and then so the software, is very robust. It looks like it's very well organized. But what's the learning curve of a new user? And does Novodontics provide support or videos to help a new user understand all the power that's behind Novodontics?
That is a very good question. Yes, if I believe you can still see my screen. If I go here and I click on manuals, you can see we provide a manuals for almost every part of the software. So first of all, when you switch to Novodontics or when you start using Novodontics for a new practice, we do onboarding, which completely complimentary. We do online training, 1, 2, 3 sessions, as many sessions as needed, completely complimentary. But on the top of being able to email us and call us at any time, you have very sophisticated, as you can see here, manuals for every single feature of the software, and it tells you, with index, as you can see here. This happened to be 46 pages on how to use the appointment book, although in my opinion does not need any instructions. Extremely easy. If you're using the appointment book on the iPhone or in Google, this is even easier. But yes, we provide manuals, we provide online remote training on Zoom, as many as you need. We have very thorough onboarding when you sign up, etc. So
who actually touches the software at a dental practice? Is it the dentist himself? Is it the dental assistants? Is it the office staff? Who uses it most?
everybody, most the girls who do the billing probably use it the most. But of course, in the back, we say back office and front office in dental offices. So probably I would say the front office personnel do use the software more. But that said, the doctor also uses the software after every single patient. You have to do the clinical notes. You have before any patients, you have to evaluate the x-rays. But the front office, making appointments all day and completing the appointments all day and doing billing for the billing the patients or billing the insurance companies, what have you. So there is more use of the software in the front office.
Okay. And do you want to say anything about the security or privacy protections that are embedded in the software?
So the data, all the data is not stored on your local computers. So everything is on the cloud with AWS, and we pay for the highest HIPAA compliant tier with AWS. So our data is very secure, backed up probably every minute, literally with AWS, Amazon Web Services. That's probably the most reliable in America, and the most secure, HIPAA compliant. So we do follow all the required
Okay.
yeah, there is plenty of HIPAA laws that controls where the data can be saved and etc. And we're definitely HIPAA compliant. We take this very seriously.
Sure. Well, I think that brings us just to about the end of the 45-minute slot. So it was an excellent presentation on Novodontics, very powerful software. So I'd like to thank Dr. Louis Alfaraj, founder and CEO of Novodontics, for introducing Novodontics to us. So thank you.